So Dr. Jarvis, the floor is yours.
Good afternoon, and thank you for joining us today. As always, Paul and I are practicing good social distancing and wearing our masks from our good friends at Intention, as is Joseph, who's running our camera and tech for us today. But I'm going to take it off for sound quality. Let's start off with giving you some numbers. Currently, Northern Light Health is taking care of 9 individuals who have active COVID-19 infection. 6 of those are being taken care of by our home care and hospice at home, and then 3 of them are inpatients at Mercy Hospital. And currently, Eastern Maine Medical Center has no COVID-positive patients in-house. To date, Northern Light Lab has performed 14,623 tests, with 347 of those testing positive. I want to talk a little bit about social distancing and face coverings, particularly in light of the fact that the state of Maine is reopening much of its economy. The weather is getting nicer and people want to just be outside and enjoy the wonderful weather that we have. But as I go around town, I notice that some people just are not wearing face coverings while they're out and ignoring that social distancing guidance. Some of that, I'm sure, is that sense of security from the fact that our numbers have been low in the state and that the last few days those numbers have declined, which is wonderful news. But as we look around the country and see other states that have reopened, we know that this can cause people to start being more close together and have a spread of the virus and increases. Study after study has shown that the precautions we took in place in the state of Maine, particularly with closing down certain parts of our business, mandating social distancing and face coverings while out in public places, actually not only stemmed the spread of this disease, but saved lives. And that's the important thing. It sounds like we drone on and on about this, and it kind of gets tuned out at some point. But it's important that we continue this. It's frustrating, it's isolating, it's difficult, but all of those measures are necessary in order to keep our friends, families, communities, and the entire state of Maine safe and healthy, and that's really where our endeavor is. For those of you who are challenged with the face coverings and find them inconvenient if you have to wear them at work or out into public, some advice that I have for you. One is find some time where you can take a break from wearing that face covering. Obviously, you need to make sure that you're maintaining social distancing, but while the weather is nice outside, take some time to go outside and take that face covering off, just making sure that you're remaining at least 6 feet away from other individuals when doing so. Try different face coverings. Some people find the cloth face coverings more difficult to wear than the neoprene ones, and so one of those may be a little bit better for you. Some people find that the mask designs are difficult to wear as well, so you may want to try using a neck gaiter or a scarf or some other face covering. Remember that the purpose of the face covering is moisture or droplet spread that come out of our mouth and nose when we talk, sneeze, cough, sing, or yell. Yep. Test. 1, 2, 3.
Yep.
This is Paul. Can you hear me? Test. 1, 2, 3.
Okay, so I think we're good with audio. Dr. Jarvis, Joseph, when you have the camera back on Dr. Jarvis, we can begin. Dr. Jarvis, you cut out right after you said try different face coverings.
So are we good now? Can you hear me now?
Yep. Wait just a sec for the camera. Okay, you should be good.
Very good. I apologize for the technical difficulties. So I was talking about changing face coverings, trying different face coverings. So if you find that the traditional cloth face covering that looks more like a mask is difficult to breathe with, you may want to switch to a neoprene sleeve and see if that's a little bit more comfortable. For a lot of individuals, using a neck gaiter or a scarf or some other covering has been found to be a little bit easier to wear, particularly for longer periods of time, for those individuals who are not used to wearing masks, such as our healthcare workers are. Remember that the whole purpose of wearing a face covering is to limit the spread of the moisture or droplets that come out of our mouth when we talk, sneeze, cough, sing, or yell. And so that's the purpose, and we need to continue to do that, especially as we open up our community and our economies. I do want to give a little bit of an update on testing. On June 15th, Northern Light Health was able to expand its COVID-19 testing to include the top 3 tiers of at-risk individuals, and that includes, like we've said before, individuals who require hospitalization for infection of this disease, symptomatic healthcare workers and first responders performing direct patient contact, symptomatic people living in congregate or group living situations like long-term care facilities, group homes, assisted living facilities, and shelters. And now we've added symptomatic individuals who are over the age of 60 or who have chronic medical conditions who would be at risk for severe disease. And lastly, being able to actually increase now where we can test any individual who is symptomatic for COVID-19. So we're very pleased that we can do this, and we know this will serve our communities and our state well. All this increased activity, people have heard that there is now a standing order for people to get the tests done without having to get a doctor's order or a provider's order. And while that is true, that the state has granted us the ability to do that, we still require at Northern Light Health that you go through our nurse triage line to make sure that it's appropriateness of the test and to make sure that we get all of your identifying data down so that we can contact individuals if appropriate when their test results come back. People who come from outside of Maine can skip the quarantine process if they did have a valid COVID-19 negative test within the 72 hours before crossing the border. I will state that this does not go into effect until June 26th, so it's not effective right now. And it is the governor's intention that individuals receive that test prior to coming to the state of Maine, and so they should have that in the state that they're currently residing in prior to coming in. We will continue to evaluate whether or not Northern Lights screening and testing centers can accommodate travelers from outside the state, but did want to make sure that people understood that does not go into effect until next week. And now I'll turn it over to Paul, who'll give us some updates on partnerships within the community.
And let me just do a sound check. Andy, are you able to hear me?
Can you say a few more words?
Test, test, test. 1, 2, 3.
No, Joseph, his mic isn't very loud either.
Test, test. He's adjusting it
No.
now. How's that?
Still not great.
I'll give him a moment and then we'll give it another test. Test, test, 1, 2, 3. Is that any better?
It's better, but not very good.
How about now? Is it any better, Andy?
No, I wonder maybe we could have you take Dr. Jarvis's mic.
Pass that on to you.
And I will gel after touching it.
Oh,
So test, test. How is that?
yeah, that's good. Thank you.
All right. So again, thank you for your time this afternoon. I just wanted to elaborate a little bit more on some of the comments that Dr. Jarvis made regarding masking and distancing in public. Northern Light Work Health in particular is working with Northern Light, Acadia Hospital, Northern Light EAP, with employers in our communities as they resume operations. And we hear time and time again from many of those employers that they're working very hard to keep their employees safe. And so masking and distancing in public is not only appropriate etiquette, but really is an essential way to ensure that our economy continues to be able to open and provide services throughout the community. So we certainly are working with those businesses to address some of the concerns, but the cooperation of the community in masking and in social distancing is critical to that equation. And so that would be my plea for the day as we continue to work with businesses on their reopening, and a critical point that I wanted to emphasize. Thank you.
Now it's time for questions. We'll do our best to work through the audio issues. Appreciate your patience today.
Yeah, actually, I just have one more thing to kind of cover before we go to questions, if you don't mind, Andy. I did want to end on a positive note, and I want to share this, which we received in the mail today. You can see a beautifully handwritten, wonderful penmanship note, and this came addressed to the doctors and nurses at EMMC. And it says simply, "Thank you for putting your lives at risk to save others. You have so much pressure put on you trying to cure patients. If we didn't have doctors and nurses like you, this outbreak would be a lot worse. You guys are so brave to do this. You deserve more appreciation than what you get. Thank you so much." Signed, Noel, 8th grader from Old Town. And if you'll indulge me on a little bit of editorial, that message conveyed states that you are valued, you are helpful, and you make a difference in the lives with your actions. If only our leaders, political, scientific, economic, could speak as eloquently and succinct as this young woman, 8th grader from Orono, we would not see this divide that we see increasing, but instead we'd be coalescing on a simple message. If you do good things will happen. And with that, we'll take questions.
Okay, so the order for questions will be WGME, WERU, PV7, and WABI. I'll call on each media organization and unmute you. You'll have a chance to ask 2 questions. Again, we'll do our best to try to make the audio work for your questions today. If you'd like, you can address your question to Dr. Jarvis or to Paul, or if you don't know who the best person is to answer it, we'll figure that out as we go. And so with that, WGME, you are up. WGME, do you have a question? Okay, we'll come back to WGME. Let's go to Amy Brown, WERU.
Thank you. First, I wanted to just clarify something that you had stated about out-of-state tests. Do I understand you correctly that you're trying to determine whether or not you have the capacity to do those tests for tourists coming who are asymptomatic, who are just trying to get the test done in order to avoid the quarantine in the state when that process goes into effect?
Yeah, so the question was by Amy, and thank you for the question, whether or not, whether Northern Light Health right now is trying to determine whether we have the capacity to test asymptomatic individuals, particularly those who want to travel to Maine if they have been outside the state, not in New Hampshire or Vermont. And you're correct, we are evaluating that as we speak. As you know, it has been a long process for us to continue to expand testing in areas where we believe it is important. We have always focused in on those patients at the highest risk and who needed hospitalization, as well as our first responders, healthcare workers, and the like. So we are very pleased that we now can expand that to any symptomatic individual and certain asymptomatic individuals. So we will continue to work on that and work on a strategy to assist the state in this process. But again, I will remind your listenership that the governor has requested that travelers be tested prior to coming into the state of Maine in order to facilitate a rapid response and also to protect the amount of testing equipment, supplies, and our resources here in the state of Maine for those individuals who deeply need it. But we will continue to work to improve our testing capacity, as well as work with our partners across the state to improve the testing capacity across the state.
Right, and people who get tested in the state have to quarantine while they're waiting for their test results as well. My other question is about the study that's being widely reported today out of the UK on dexamethasone. It apparently has decreased the risk of death by about 1/3 for patients who are on ventilators and about 1/5 for people who otherwise were receiving oxygen. And it was a rather large study, although the results are preliminary. Is this anything that's on the radar here in Maine at all yet?
Yeah, so Amy's question was about the study that came out recently that talked about dexamethasone, and I call it a study, but I really shouldn't. It was simply a report. And that's something that's important to remember. So yes, we are excited by this news, but we can't hold ourselves up to saying that this is going to be the thing that's going to be the most helpful for us, because it has not gone through the rigorous peer review that needs to be done before a study is published, and that we all feel comfortable that this is the best way to manage our patients. We are well aware of the paper that will probably be presented, and are looking at that as yet another tool in our toolbox to help with this disease. But as you're aware, we have had these kind of pronouncements made before, only to find out later that after scrutiny of those tests that unfortunately the particular medication or treatment method has not turned out to be as useful as we had hoped. We hope this is one of those things that will turn out favorable, and we will continue to monitor that situation, and our clinicians, our pharmacists, and our other healthcare workers are well aware of that, and we continue to follow the literature as it comes available. So thank you for that question.
Great, thank you.
Next up we have WVII TV7.
Yes, thank you. So, quick question. A lot of people have been speculating that there may be another spike in cases in the fall. Is there any validity to that, and are you prepared for something like that, or is that just something people have been, making up?
So the question was really about what, either a second spike or a second surge of cases probably in the fall of people infected with coronavirus causing COVID-19. There are several models out there that talk about different things that will happen in the future as we go through this. I am certainly one that feels that we will be dealing with this particular virus for a long time, at least until we have an adequate protection from a vaccine and that enough individuals are vaccinated. It is hard for us to predict what will be happening going forward in a precise manner. If we look at past pandemics, particularly the influenza pandemic of 1917, 1918, and 1919, they did have that second surge. It did happen during fall season. It was actually far worse than the initial surge that happened with the disease. There's many factors to that, not the least of which is that social distancing and face covering that have been put in place became lax, and therefore more people were exposed. That is probably the most likely scenario with COVID-19, but this is a different kind of virus. It is not influenza, and as we have been challenged throughout this entire pandemic, every day we learn something new about the virus, and most of the time it is not something that is good. So this virus will probably do some things that are unpredictable and unexpected, but preparedness, yes, we are prepared just like we were prepared for the initial stage. We continue to train, we continue to learn more, and we continue to be ready in case that we need to, as healthcare providers, have an increase in the number of people who need our services, and we will take every precaution that we need to protect ourselves and protect our staff so that they are ready and able to protect the population at large. So thank you for that question.
Yeah, thank you. Appreciate it.
Do you have a second question?
No, that was the only one. Thank you.
We're going to try WGME again. WGME, are you there? Looks like, are you there? Looks like they may be recording, but that was the call. So we'll go through one more time, and we do have some time left. I'll just go through quickly and make sure that no one else has questions. If you do, we certainly have time for it. Amy, WERU, do you have any additional questions?
No, thank you.
Okay. Well, I think that wraps things up for today. Again, I'll send the link to the audio video file after the conference today. Apologies for the sound issues today. We'll work on that and make sure that we have it in order for next time. Appreciate everyone attending and for helping us spread the word.
Thank you, everyone.